6 exercises that correct 90% of your mobility problems. Lack of mobility is a silent but extremely serious problem. It gradually steals your independence, your quality of life, your freedom. And the worst part? Many people don't even realize it's happening. They simply think that waking up with a stiff body, feeling pain when getting out of bed, making a face to tie their shoes, or feeling their back complain every time they try to look behind while driving is natural aging. But it's not. The good news is that this stiffness limiting your movements, preventing you from picking up objects from the floor without pain and turning getting in and out of the car into something uncomfortable, can be completely reversed. That's why today, you'll see 6 simple exercises, done at home, without any equipment, and investing only 15 minutes per day. These movements can correct 90% of your mobility problems and restore the freedom you deserve. Before we begin, please tell us through the comments your name and the city you're watching our content from. We'd love to know. Exercise number 1, 90-90 hip rotation. This is one of the most powerful exercises to restore hip mobility, especially the internal and external rotation movements that become extremely compromised in those who spend a lot of time sitting. The hip is designed to have wide rotational capacity, but years of static posture in chairs literally freeze this function. When you lose rotation in the hip, your body compensates by forcing other joints, especially the lower back and knees, to move in ways they weren't designed for, generating chronic pain and even more serious injuries. The 90-90 rotation works intensely, the gluteus maximus, the deep hip rotators like the piriformis and the pelvic floor muscles, while also stretching the hip joint capsule. To execute, sit on the floor with your legs bent, one leg in front and another behind, both forming 90-degree angles. Your front knee points to the opposite side of the back leg. From this position, use your hip muscles to rotate your legs simultaneously, switching which leg is in front and which is behind. The movement should be controlled by the hips, not by your hands pushing the floor. If you feel you can't sit in this position without supporting your hands, this already indicates the level of restriction your hips have accumulated. The main mistakes include overusing your hands to propel yourself, rotating too fast, losing muscular control, and not keeping your chest upright during the movement. Many people also try to force a range they don't have yet, which can generate discomfort on the inside of the knee. Start slowly, respecting your current limit. Do 2 sets of 8 transitions, moving slowly from one side to the other. Over time, you'll notice you can sit more upright in this position, and the transition will become more fluid. This exercise is fundamental for those who have difficulty sitting cross-legged on the floor, feel deep stiffness in the hips when trying to open them laterally, or experience lower back discomfort when rotating the trunk. There are no significant contraindications, but if you have acute injuries in the hip or knee, start with reduced range and progress gradually. Number 2, hip airplane. The hip airplane is an exceptional exercise that combines rotational mobility with unilateral stability, 2 components frequently deficient in those living a sedentary routine. This movement works not only the hip's rotation capacity, but also deeply strengthens the lateral stabilizers, especially the gluteus medius and the core muscles that need to maintain your balance during execution. The unilateral position forces your body to recruit stabilizing muscles that are rarely activated in daily life. To execute, stand supported on one leg only. Lean your trunk forward while extending the other leg back, forming a straight line from the elevated heel to the head like an airplane. With your arms extended laterally to assist with balance, rotate the hip of the support leg so that your chest turns toward the ceiling and then toward the floor, keeping the back leg fixed in space. Imagine you're trying to show your chest first to the ceiling and then to the floor. Start with 5 to 8 rotations per side. Rest and repeat. You can progress by increasing to 10 to 12 rotations or reducing external support as you gain confidence. The main mistakes are excessively bending the support knee, losing the straight line of the body when leaning, rotating only the shoulders instead of the hip, and doing the movement too quickly without control. It's essential that you feel the support hip actively working, not just the shoulders rotating. If necessary, initially hold onto a wall or firm chair until you develop adequate balance. This exercise is especially beneficial for those suffering from lower back pain related to lack of hip mobility, as it teaches the body to generate rotation where it should occur naturally, relieving pressure on the lower back. It also significantly improves balance and proprioception, skills that deteriorate with age if not trained. People with severe balance problems or dizziness should start close to a safe support. Number 3. Quadriceps stretch with knee on floor. This is undoubtedly one of the most effective stretches to release the hip flexors and quadriceps, two structures that become extremely shortened and tight in anyone who spends hours sitting daily. When the hip flexors are chronically tight, they pull the pelvis into an anterior tilt, creating an excessive arch in the lower back that overloads the vertebral discs and generates chronic back pain. This exercise not only stretches these structures, but also teaches your body to reposition the pelvis adequately. The stretch works mainly the rectus femoris, the iliopsoas muscle, and the tensor fasciae latae, while also recruiting the gluteus maximus of the back, leg to stabilize the pelvis. To execute, position yourself as in a lunge, but with the back knee supported on the floor and the top of that leg's foot resting against a wall or sofa behind you. The front leg stays with the knee bent at 90 degrees. The fundamental key is to tuck your tailbone and actively squeeze the glute of the back leg, pushing the hip slightly forward without arching the lower back. You should feel an intense stretch in the front of the hip and thigh of the back leg. Hold for 30 to 60 seconds on each side, breathing deeply. The most common mistakes are excessively arching the lower back instead of keeping the pelvis neutral, not squeezing the glute of the back leg, leaning the trunk forward, and not keeping the front knee aligned over the ankle. Many people also force the stretch too much right at the beginning, which activates protective reflexes that limit gains. Be patient and progressive. If you feel discomfort in the knee that's on the floor, use a cushion or folded mat underneath. You can progress by bringing the hip closer to the wall as you gain flexibility. This exercise is essential for anyone with chronic lower back pain, poor posture with tilted pelvis, or difficulty standing for long periods. Avoid if you have acute injuries in the knee or hip, and never force beyond a comfortable stretch. Before we continue, don't forget to subscribe to the channel. Having constant access to science-based information is what will make you progress with health long-term in the world of weight training. Number 4. Book opening for thoracic spine. The thoracic spine, the region between the neck and lower back, is one of the areas that loses the most rotational mobility in the modern body. Hours hunched over computer and phone screens literally freeze this region in a posture of flexion and limited rotation. When your thoracic spine can't rotate adequately, your body compensates by forcing excessive movements in the lower back and neck, two regions that weren't designed for so much rotation, resulting in chronic pain and even herniated discs. The book opening works specifically the rotator muscles of the thoracic, opens the pectoral that becomes shortened, and restores rib mobility, even improving respiratory capacity. To execute, lie on your side with your knees bent at 90 degrees, one on top of the other, and your arms extended in front of you also overlapped. Keeping your knees firmly stacked and stuck to the floor, rotate your top arm in a large arc, trying to touch the floor on the opposite side behind you. The movement should come from the rotation of the thoracic spine, not just the shoulder. Your eyes should follow the moving hand, helping to maximize rotation. Do 8 to 10 slow and controlled repetitions on each side. The main mistakes include letting the knees separate or lift from the floor, rotating only the shoulder without involving the spine, doing the movement too quickly without exploring the full range, and forcing the arm to touch the floor instead of letting the rotation come naturally. Remember that the hand doesn't necessarily need to touch the floor behind you. The important thing is to feel the rotation happening in the middle region of the back. As you practice, the range will increase naturally. You can progress by doing the movement more slowly, pausing at the end of the rotation for a few seconds, or making small oscillations at the end of the range to gain a few extra degrees. This exercise is crucial for those who feel stiffness between the shoulder blades, have shoulders rounded forward, difficulty looking behind while driving, or pain in the middle back region. There are practically no contraindications, but people with acute spine injuries should start with reduced range. Number 5. Cat-cow. This is probably the most fundamental and accessible spinal mobility exercise that exists, working the spine in its entire length from the tailbone to the base of the skull. The cat-cow teaches your body to move segmentally through the spine, a skill we completely lose with prolonged static posture. When you spend hours stopped in the same position, the intervertebral discs dehydrate and the facet joints become stiff, leading to pain and loss of range of motion. This exercise literally lubricates these structures through fluid movement between flexion and extension. It works all the muscles that control the spine, including the erector spinae, the deep multifidus, the rectus abdominis, and the obliques. To execute, position yourself on all fours with your hands directly under your shoulders and knees under your hips. In the cow phase, inhale deeply while gently arching your spine, letting your belly descend toward the floor, simultaneously lifting your chest and chin to look slightly upward. In the cat phase, exhale completely while rounding your spine, pushing the middle of your back toward the ceiling, tucking your tailbone, and letting your head fall naturally between your arms. The movement should be fluid and rhythmic, like a wave traveling through the spine. Do 10 to 15 repetitions, synchronizing each phase with your breathing. The main mistakes are doing the movement only in the neck or lower back, instead of involving the entire spine, moving too fast without exploring each segment, locking the elbows, and not coordinating adequately with breathing. Think of initiating the movement from the tailbone and letting it flow vertebra by vertebra to the neck. You can progress by doing the movement more slowly to increase segmental control, pausing briefly at the extremes of each position, or adding a third series. This exercise is especially beneficial for those who wake up with a stiff back, spend the day sitting, or feel they've lost general spine flexibility. It's safe for practically everyone, but people with acute injuries should work with reduced range initially. Number 6. Deep squat with arm reach. This is one of the most complete movements for mobility that exists, simultaneously combining 3 frequently limited components: deep hip mobility, ankle flexibility, and upper thoracic spine rotation. It's an exercise our ancestors did naturally every day when squatting to eat, rest, or work, but which we've completely lost with chairs and elevated furniture. When you recover the ability to squat deeply with your heels on the floor, you're restoring fundamental movement patterns that benefit countless daily activities. This exercise works intensely the gluteus maximus, the adductors, the hip flexors in stretch, the calf muscles, and the thoracic rotators. To execute, squat as deeply as you can while keeping your heels firmly planted on the floor. Your knees point in the direction of your toes. Place one hand on the floor between your legs for support and stability. Rotate your trunk, reaching the other arm toward the ceiling, opening your chest and following the hand with your gaze. Do approximately 5 slow reaches on each side while maintaining the squat position. The main mistakes include lifting your heels off the floor, excessively collapsing the lower back, not actually rotating the thoracic and only moving the arm, and trying to descend more than current mobility allows. If you can't keep your heels on the floor initially, place a folded towel or small plates under them temporarily. As you practice, gradually reduce this elevation until you can do it with your feet completely flat. You can also hold on to something fixed in front of you if you need more stability at the beginning. Maintain the squat position for about 1 minute total, alternating reaches between sides. This exercise is excellent for those who feel generalized stiffness when moving on the floor, have difficulty squatting deeply, or want to improve mobility for deadlifts and loaded squats. People with acute knee injuries should be cautious and use reduced range initially. Bonus exercise: ankle rocks. If you do these 6 exercises consistently, you'll already see a huge change in your body and your daily life. However, here's one more exercise to further complete your development. Ankle rocking is often ignored, but mobility of this joint is absolutely crucial for practically every movement you do standing. Stiff ankles compromise your squat, your gait, your balance, and even your posture, because when they don't move adequately, the body compensates by hyperextending the knees and excessively tilting the pelvis. Improving ankle dorsiflexion, which is the ability to bring the shin toward the top of the foot, dramatically improves squat mechanics, reduces the risk of sprains, and even relieves knee and hip pain. This exercise works the ankle complex, including the talocrural joint, the calf muscles in stretch, especially the soleus, and the intrinsic foot stabilizers. To execute, stand facing a wall approximately half a meter away. Step forward with one leg, keeping both feet pointing straight. Forward. Keeping the front leg's heel firmly on the floor, push the knee toward the wall, bending the ankle to the maximum. The goal is to touch the wall with your knee without lifting the heel. Rock gently forward and backward, exploring your current dorsiflexion range. Do about 10 to 15 rocks on each side. The main mistakes are letting the heel lift, rotating the foot outward instead of keeping it straight, not keeping the knee aligned over the second toe, and doing abrupt movements instead of controlled ones. You can progress by gradually moving away from the wall as you gain mobility, which increases the necessary range. You can also make pauses of 3 to 5 seconds in the position of maximum dorsiflexion. This exercise is essential for athletes, runners, anyone who squats with weight, and elderly people who want to prevent falls by improving balance. Avoid if you have acute ankle injuries or inflamed Achilles tendon. In these cases, wait for complete recovery before starting. If you liked this and want to discover also 6 exercises that use the wall to transform your body without aggressing your joints at all, we've left a video appearing right now on the screen showing better each one of them. Don't miss checking it out. Thank you for watching until here, and may God bless you, my friend.